Thank you so much. I appreciate it, Karima. And yes, for those of you that I haven't met before, my name is Cheryl Graffinino. And I am a program officer with the Osteopathic Heritage Foundation. I have been here a grand total of 2 months and 10 days now. And so it's been a wonderful learning experience and a great transition. But I'm excited because it's what I'm sharing with you tonight is going to connect very deeply to the work that I did for 6 years prior to this, which was serving as the Columbus Public Health lead to help the city's implementation of the city and county local food action plan. So very excited to share some of the things that the Osteopathic Heritage Foundation is doing to support that work in the coming years. So if you can go ahead and go to the next slide for me, Karima. I'm really looking forward to, over the next 15 to 20 minutes, telling you a little bit about the Osteopathic Heritage Foundation's, our funding approach, and specifically our Healthy Food Access funding priority, which is really the impetus for the request for proposals that I'll share a little bit more about as well. And many of you probably saw it go out into the media on Monday. So if I could have the next slide, please. The Osteopathic Heritage Foundations consists of 2 private nonprofit foundations that includes the Osteopathic Heritage Foundation and the Osteopathic Heritage Foundations of Nelsonville. The foundations advance their mission to improve health and quality of life in the community through education, research, and service consistent with our osteopathic heritage. And we do that through strategic funding partnerships, through multi-year funding commitments, and through significant investments in osteopathic research and medical education across Ohio and nationally. In addition, the foundations also pursue opportunities to advance innovative solutions, long-term impact for vulnerable populations and communities, and measurable outcomes and sustainability. So as we serve our national and statewide interests, particularly related to osteopathic medical education and research, we focus our philanthropic activities in communities primarily in central and southeastern Ohio. If I could have the next slide. The foundation's grant-making approach is aligned with our osteopathic medicine's approach to patient care and service in the community. This means that we apply a holistic lens to funding investments because we recognize that the health and well-being of our communities, families, and individuals are influenced by a host of conditions, including our access to clinical care, social and economic factors, the physical environment as well. And by applying this approach, we seek to make for our grant making to be transformative in its impacts and realize and build resilient communities. But as the needs in our communities we serve change over time, the priorities of the foundation also evolve. However, they will always have and always will remain rooted in the principles and practices of osteopathic medicine and our mission to improve health and quality of life. The issues we seek to address are complex, and as such, the foundations engage in strategic partnerships with funded agencies. We engage with other funders, community leaders, and professional organizations to encourage collaboration, propel innovation, leverage resources, and create meaningful impact on pressing health and social issues. As you can see in the graphic provided here, the foundation's funding priorities include behavioral health and substance use disorders, collaborative funding partnerships, community responsive grants and sponsorships, osteopathic research, osteopathic medical education, and healthy food access. Our funding investments are considered through invitation to submit process, funding collaborations in which resources are distributed in partnership with another funder, or through requests for proposals such as the Healthy Food, Healthy Franklin County request for proposals that went out this week. Next slide, please. And so to share with you a little bit, the foundation's Healthy Food Access funding priority is what I'm here to talk a little bit about tonight, and it's what the RFP that went out this week is rooted in. It's rooted in our understanding that the prevalence of both food insecurity and lack of access to healthy food in the community, and that community health is improved when fewer people experience hunger and more vulnerable people have access to healthy food. The foundation has adopted a dual strategy of building capacity and supporting innovation within the emergency food system, while simultaneously investing in system efforts designed to increase access, affordability, and consumption of healthy and local foods in underserved communities in Franklin County. To help kind of illustrate how we do this, the foundation's recently committed support for the Mid-Ohio Food Collective's Mid-Ohio Market Strategy is an example of our investments in the emergency food system. And on 12/13, on Monday, the foundation announced the Healthy Food, Healthy Franklin County request for proposals, specifically designed to support efforts that measurably increase the availability, affordability, and consumption of healthy local food among vulnerable people in Franklin County. Next slide, please. So the foundation investments under this RFP will be informed by the Local Food Action Plan, which was adopted by Columbus City Council and Franklin County Commissioners in 2016. A central goal of the Local Food Action Plan is improving access to and education about healthy, affordable, and local food. The Local Food Action Plan includes community-guided actions and strategies to address hunger and food insecurity, ways to strengthen the local food economy, and other innovative approaches to improve the local food system, which align with the foundation's goal to reduce hunger and improve health outcomes by increasing access to fresh, healthy, affordable, and local food in Franklin County. The Healthy Food, Healthy Franklin County request for proposals will focus on projects that support the objectives that you see on this slide, including increasing the supply and demand for locally grown food and distribution chains to support a strong local food system, support economic growth and opportunities in low income and low access communities as well. We also will support projects that increase the availability of healthy food in neighborhoods with low access through healthy food retail strategies, including corner stores, grocery stores, markets, pharmacies, medical facilities, farmers markets, farm stands, and mobile food distributions. And also in increasing access to healthy food through expanded use of healthy food purchasing incentives. Next slide, please. The request for proposals will be a multi-step process. The first is to submit a letter of intent through the foundation's online application system no later than January 28, 2022. As a courtesy, we've included a Word version of the letter of intent questions that you can download from our website so that you can work on your submission offline. However, it's very important to know that you must enter all required information to the online system, upload either an IRS letter of determination or designation as an instrumentality of government, and submit your letter of intent through our online grant making system. It must be submitted through the online grant making system. The foundations will convene an external review committee to assist in our review of the letters of intent, and the foundations will determine which organizations to invite to submit a full proposal, and all applicants will be notified of the status of their proposal on February 25th, 2022. The foundation will host an RFP briefing on March 9th, 2022 for those applicants selected to submit a full proposal. And full proposals will be due to the foundation on April 4th, 2022. Foundation staff will conduct site visits to each applicant between April 18th and April 29th. And we expect funding award notifications will be made the week of June 20th. Next slide, please. So the total funding available for the Healthy Food, Healthy Franklin County RFP is $1 million. It's anticipated these funds will support multiple projects over the funding period. We do not have a set minimum or maximum funding amount, but we ask that your requests reflect the funding resources needed to implement the project effectively and demonstrate ability to fulfill the goals of the RFP. A funding match is not required, but funding requests should not be the sole source of funding for the proposed project. Applicants must have other funds committed to the project, and you'll be asked to list the amount and source of those funds in the letter of intent. The foundation is committed to supporting innovation in the food system that will have a lasting impact in the community, and funding awards through the RFP will prioritize projects that have or will develop multiple funding sources such as earned revenue or shared cost agreements in addition to grant funding. And activities funded by the Healthy Food, Healthy Franklin County RFP must start on or after August 1st, 2022 and be completed by August 1st, 2024. We do realize that some projects may be able to be completed in a shorter time frame, and it's even possible that some may need a little longer than a 2-year process. And those are certainly things that we encourage you to reach out and talk with us about. But again, just as we talked about with the funding, your request should reflect the time you need to implement the project effectively and demonstrate your ability to fulfill the goals of the RFP. I also in this space want to encourage you to note and understand that this is our first step in a multi-year funding commitment. Our Healthy Food Access funding priority is not a 1-year project. This is in a consistent investment priority from the foundations. So I also encourage you to recognize that, you know, this is not a proposal that will be one and done, and you must get all that you can in the first one. We encourage you to think about what do you need to move your organization closer to its vision, and what do you need now? There will be additional investments in this system in the coming years. What that looks like will depend a little bit based on what we find in the RFP process. But just be aware that we really want you to think about what do you actually need to move your organization to another step closer to your vision. Next slide, please. So who can apply? Nonprofit and public organizations that serve vulnerable residents in Franklin County may apply for the funding under this RFP. Requests from food pantries or those strictly for emergency food responses won't be considered under this RFP. The foundations support innovation in the emergency food system in Franklin County through other funding partnerships. For example, the one that I just described about our recent commitment to Mid-Ohio Food Collective. A fiscal agent can accept and be responsible for grant funds on an applicant's behalf. You'll need to provide information about the organization that will be fiscally responsible for the funding in the letter of intent. And if invited to submit a full proposal, the applicant organization and designated fiscal agent will be required to submit a signed fiscal agreement. Collaboration with other agencies is encouraged. A collaborative proposal allows multiple organizations to work together and leverage their existing organizational assets and strengths to successfully manage a project. Collaboration can also increase the chances of program success, maximize resources, and most importantly, can lead to greater impacts for people in the community. In the letter of intent, collaborative proposals must identify a lead agency who will ensure project deliverables are met and that all required reports and communications with the foundation are completed. Collaborative proposals must also identify which agency will be fiscally responsible for receiving and managing the grant funds. In the letter of intent, if invited to submit a full proposal, the organizations and designated fiscally responsible organization will be required to submit signed agreements or MOUs indicating their roles. The foundation also recognizes the need to foster urban and rural connections in the food system. Proposals may include partners from other Ohio counties besides Franklin if the result is an increase in the availability, affordability, and consumption of healthy local food among vulnerable people in Franklin County. But the beneficiaries of the project need to be vulnerable residents in Franklin County. And so how can the funds, next slide, please. So funds can be used to support things like program costs, personnel, consultation services, training, equipment, and capital. It cannot be used to support or promote a specific view on religious or political issues, supplement or replace operating budgets, fund activities that are normally the responsibility of public or governmental organizations, support political candidates, or purchase equipment or services from individuals or organizations that will unreasonably benefit through fees for service or tuition payments. And it cannot be used to repay debts. If you could click again. Other costs that support the objectives of the RFP will be considered. So if there's something that you're seeking to fund that isn't clearly on one of these lists, it's not clearly prohibited. As a general rule, it is something that we can consider and talk about. We encourage you to reach out and give us a call and ask questions. And then next slide, please. So I wanted to take a few moments to share with you a video from a project that we have funded in Southeast Ohio, the Appalachian Accessible Food Network. And while the RFP seeks to build on the successes and assets in our community, supporting efforts to enhance or expand healthy food access initiatives that are existing, and foster the development of new and innovative strategies. So as we look at this video, it is an example of how we've supported this work before. And while Franklin County is different from Southeast Ohio, not only in geography and population, but also in existing resources, capacity, and needs, I hope that this video will provide a little more context and maybe some inspiration for you. So if you can share the video, Karima.
Familiar with the story of Southeast Ohio and Central Appalachia being a place of high food insecurity and poverty, there's another story of creating transformative, sustainable change for food access for all.
This project really allows us to be able to lift the voice of many, to look at new innovations, new ways we can really find solutions to get more food access to folks in places that have been kind of neglected.
So this is a partnership between Rural Action, Community Food Initiatives, and AceNet. We're hoping to bring real opportunities to people by not only increasing the availability and access of local foods, but also strengthening the production and consumption component of our local value chain.
At Community Food Initiatives, or CFI, our mission is to foster communities that ensure equal access to fresh, healthy local food for everyone. With the donation station, this is a more transformational approach to addressing hunger. We're partnered with our local and regional farmers and food producers by vending at our Athens Farmers Market, as well as Rural Action's Chester Produce Auction, where we solicit financial donations, which are then spent to purchase that local food at retail price, supporting the economic viability of our local farmers and food producers. And we also accept local food donations, and we then turn around and distribute that out to area food pantries.
This is the Chester Hill Produce Auction. We serve 125 farmers here. We serve the farmers with the infrastructure, we serve the farmers with the marketing, we serve the farmers through distribution, we serve the farmers through education. The whole goal is to put money into a farmer's pocket and to put food into a hungry person's mouth.
Several years ago, Rural Action started a program called Country Fresh Shops, where they partner with local convenience stores, hospitals, and universities to sell local produce from the Chester Hill Produce Auction. Just this past year, they opened a Country Fresh Shop at Glennis Hospital, which has really benefited the community by making food accessible to employees and community members and reinvesting into our local food economy. Another initiative we have is Farm to School, where we're able to process, meaning fresh cut or freeze, local foods that would not otherwise be accessible for several school districts. This program encourages healthy eating habits and is another market that can support our local farmers.
I think AceNet really adds to the mix here. Because we have the infrastructure in place, the Food Venture Center and the Nelsonville Food Hub, we have the facilities and really the people power and sort of the intellectual capital to figure out how to aggregate produce, to be able to warehouse it, to store it, to create the logistics. We have 2 additional years from the Osteopathic Heritage Foundation. We would not be able to do this great work without that investment and the investment of many of our other private and public funders in the region.
The goal is to build an equitable local food system. A local food system that feeds people from every economic background.
Thank you, Karima. I really appreciate you sharing that video with everyone. And again, my hope with that for everyone is to understand that, again, the foundations have provided funding with AAFN, also known as the Appalachian Accessible Food Network, that they've leveraged with other funding, including not only grants, but earned income and other resources. And all of the partners have committed to get their resources together to move this work forward. So as I shared some information earlier about an example of a collaborative effort, this is a long-term collaborative effort. I believe the work started in the around 2011. Don't quote me on that date, but I believe it started around then. And so all of those things that you see didn't happen over the course of a year. That was over a course of building a strong partnership and a strong local food system. So Karima, I don't know if my time will allow me to take a few questions that folks could pose through the chat, or if you want to hold those until the breakouts, or.
Yeah, I think if anyone has any burning questions right now, we can take two. And then if there are extra, if you could share, hold your thought, write it down and share that during the breakout session, that would be great. But yeah, if anyone, feel free to unmute and ask a question if you have one.
Hi, it's Rachel. I'm curious if there's a definition of healthy food.
Darn it, Rachel. So that's the classic question. I think that the main thing that I would stress to folks is that what we're really looking at, the core issue is going to be, of course, produce, fruits and vegetables. That's not to say that that local food system doesn't include some value-added products, those types of things. But we're probably not looking to fund, new cottage food bakeries as a whole. So if that makes sense. So really looking at increasing the fruit and vegetable context. There is also the local proteins and whole grains, those types of things. So we definitely are looking at, those issues as well, but probably focus predominantly on produce. So.
Cheryl, I have a question. The video showed a project with collaborators that were working together.
Mm-hmm.
Is the grant money that you're talking about today, is that for collaborations also? Is there a preference for collaborations, or is everything kind of wide open?
So at this point, one of the things, Noreen, that we've really tried to look at, and I'm just going to use, you and I've worked together a long time, and for those of you that know me, for the last 6 years, we've kind of either cobbled together some small amounts of city council available funding, or we've, taken very prescriptive approaches that something like a USDA grant might give us. And so one of the things that we want to do with this grant is really begin to look clearly at what does the Franklin County local food system need now, and how do we build that food system to be more effective and collaborative. As we all know, individual projects are important, but they all work in a system. And so how do we move those things forward? So I won't say that individual projects won't be considered. They're certainly an option, but we very much are focused on systemic change. And the overall impact on broad community partners. So I would say we encourage collaborations from that perspective. Did that answer your question, Noreen? And I did put my email in the chat. I've already heard from many of you. You are welcome to give me a call or send me an email, and I will always do my best to answer your questions and help you with that conversation.